What's up, everyone? Welcome to my channel. I'm super excited to have you here today. Your pancreas is a multifunction organ that plays a crucial role in digestion. In addition to releasing vital hormones such as insulin and glucagon, both of which regulate blood glucose levels. Without a healthy functioning pancreas, many things can go wrong in your body. The most common pancreatic diseases are pancreatitis, pancreatic cancer, and diabetes mellitus. Pancreatic cancer is the 12th most common cancer worldwide. It is the 7th leading cause of cancer death globally, with approximately 466,000 deaths in 2020. Moreover, diabetes alone contributed to 6.7 million deaths in 2021. This is why in this video we reveal to you 10 early signs of pancreatic diseases you should never ignore. Each of these signs alone may not be a strong indicator of pancreatic disease. Now, without any further ado, let's get to it. Number 1, abdominal pain. One of the main symptoms of pancreatic disease is abdominal pain. Anatomically, your pancreas is located behind your stomach. The pain is usually centered in the epigastric region, the upper central part of the abdomen, and may radiate to the back. When your pancreas is inflamed, the blood vessels inside it widen, causing it to swell and enlarge. Abdominal pain in pancreatic diseases is felt due to the pressure exerted by the diseased pancreas on the surrounding organs and nerves. Abdominal pain can also be a strong indicator for pancreatic cancer, as it affects 70 to 80% of pancreatic cancer patients. If the pain is persistent and unexplained, especially if accompanied by other concerning symptoms, medical evaluation is essential to rule out serious conditions. Number 2, jaundice. Jaundice, a common sign of pancreatic cancer, manifests as a yellowing of the skin and the whites of the eyes. This is a manifestation of the accumulation of the bilirubin pigment in your tissue. But what is bilirubin anyways? Bilirubin is the product of the breakdown of hemoglobin in old red blood cells in the liver. Normally, the liver excretes bilirubin in the intestines via the bile ducts. At the end, bilirubin is expelled out with stool. Whether the pancreas is inflamed or has a tumor growing in it, its head will enlarge. Consequently, the bile duct will be blocked, and bilirubin won't be excreted in the intestines. Bilirubin will then accumulate in the blood and deposit in body tissues, causing yellowish discoloration. If you or someone you know is experiencing jaundice, it is important to seek medical evaluation immediately to ensure timely and appropriate care. Number 3, fatigue. Fatigue is a common symptom that can result from a variety of underlying conditions, including pancreatic cancer. When your pancreas is inflamed, your body exerts massive efforts to try to combat this condition. Significant amounts of energy are used up in this process, which can leave you exhausted for no obvious reason. Chronic fatigue is reported by approximately 70 to 90% of patients with pancreatic cancer. So even though fatigue is a general sign, yet it can still help in the early detection of pancreatic diseases. Number 4, unexplained weight loss. Unexplained weight loss is a significant and often concerning symptom, particularly in the context of serious conditions like pancreatic cancer. If you hadn't made any significant changes in your diet or physical activities, then sudden marked weight loss should be a cause for concern. One of the critical functions of the pancreas is the production of digestive enzymes and sending them to the intestine to help in digestion. Without these enzymes, your body can't break down the large. Cancer cells consume a lot of energy, which increases the body's metabolic demand. The body may use more calories at rest than it normally would, leading to weight loss despite maintaining or even increasing calorie intake. If your body isn't getting enough carbohydrates, fats, and proteins, then you'll start losing weight. In addition to that, in case of pancreatic cancer, the cancer cells will deplete your body's stores of carbohydrates, fats, and proteins, which will also lead to tremendous weight loss. Unexplained weight loss of more than 5% of body weight over 6 months, especially when accompanied by other symptoms, warrants prompt medical evaluation. Number 5. Blood clots. Blood clots are the most life-threatening, can be a symptom of pancreatic disease, including pancreatic cancer. Pancreatic cancer can increase the risk of blood clots due to the release of procoagulant factors by the tumor cells. These factors cause small fragments of cells in your blood called platelets to stick together and cause blood clots. Tumors can compress or invade blood vessels, leading to stasis of blood flow, which predisposes to clot formation. Both arterial and venous vessels can be affected, although venous thrombosis is more common. The threat is when these blood clots block vital vessels such as those supplying the heart, lungs, or the brain. A blood clot forms in the deep veins of the legs or arms. Symptoms include swelling, pain, redness, and warmth in the affected limb. Then the affected organ will no longer receive nutrients or oxygen and will die. If you suspect a blood clot or experience symptoms, seek immediate medical attention to receive appropriate diagnosis and treatment. Number 6. Dark urine. Remember the accumulated bilirubin we talked about earlier? Well, jaundice isn't the only manifestation it causes. Your kidney filter bilirubin from your blood and excrete it in the urine. The presence of bilirubin gives urine a dark color. Some people describe that color as tea or cola-like. Particularly tumors located in the head of the pancreas, the cancer can block the bile duct. This blockage prevents bile from flowing into the intestines. Dark urine, especially when accompanied by the symptoms listed above, warrants prompt medical evaluation to determine the underlying cause and initiate appropriate treatment. Number 7. Nausea and vomiting. Nausea and vomiting are common symptoms of pancreatic disease, including pancreatic cancer, pancreatitis, and other pancreatic disorders. The blockage of the digestive tract by large pancreatic tumors can cause food to back up, leading to nausea and vomiting. Furthermore, dysfunction in pancreatic enzyme synthesis can result in indigestion. Pancreatic disease can lead to delayed gastric emptying, where the stomach empties its contents into the small intestine more slowly than normal. This delay can cause food to remain in the stomach longer, leading to a feeling of fullness, discomfort, and nausea. Addressing the root cause of the pancreatic disease, whether through surgery, medication, or other therapies, is key to reducing nausea and vomiting. Number 8. Loss of appetite. Feeling full, nauseous, or discomfort after you eat can all be signs of pancreatic disease, These symptoms will cause you to lose the desire to eat. Since the pancreas is located extremely close to your stomach and your intestines, most conditions that affect the pancreas tend to cause a loss in appetite. This can be due to pressure on these organs from the enlarged and inflamed pancreas. Moreover, the release of inflammatory molecules from the pancreas can reach and irritate surrounding organs, which leads to nausea and discomfort. According to statistical data, loss of appetite affects around 80% of patients with pancreatic cancer. Addressing it requires a holistic approach, including medical, nutritional, and psychological support to help maintain the patient's strength and quality of life. Number 9, diabetes. The pancreas plays a central role in regulating blood sugar levels through the production of insulin, a hormone that helps cells absorb glucose from the blood. When the pancreas is damaged or impaired, it can affect insulin production, leading to diabetes. Pancreatic cancer, particularly when located in the body or tail of the pancreas, can destroy the insulin-producing beta cells, leading to a deficiency in insulin. This results in hyperglycemia, high blood sugar, and can cause diabetes. Diabetes is considered an early sign denoting pancreatic disease, especially if you have no family history of diabetes. The damage to the pancreas also disrupts the balance of hormones that regulate blood sugar, including insulin and glucagon, leading to fluctuating and often poorly controlled blood sugar levels. A regular monitoring of blood sugar levels and tests like HbA1c can help diagnose diabetes and assess its severity. Number 10, changes in stools. The change of stool due to pancreatic diseases is known as steatorrhea. Steatorrhea is due to the presence of excessive amounts of fats in your stool. If there are problems in your pancreas, your stool will be looser and will acquire a pale, clay-like color. Additionally, the fat will make your stool foul-smelling, and you may notice that it floats. The pancreas produces enzymes such as lipase, which are essential for breaking down fats in the diet. If the pancreas is diseased or damaged, it may not produce enough of these enzymes. This leads to fats being undigested and unabsorbed, causing stools to appear greasy, oily, or shiny. If you notice persistent changes in your stool appearance, such as pale, greasy, or foul-smelling stools, or if there is an increase in frequency or mucus content, it's important to seek medical advice. Catching pancreatic conditions early can increase the chances for a better prognosis, so pay attention to what your body has to say. Now, we want to hear from you. Have you or anyone you know experienced any of these signs before? According to your doctor, what was the underlying pancreatic disease? Thank you for being here, for your continued support, and for being part of this amazing community. I appreciate you more than words can express.